January 17 is when we celebrate cervical cancer globally. That makes January the month where cervical cancer is being celebrated. So I'll be telling us today how a cervical smear, which is also called a pap smear, is being done, which is a screening modality to check for the presence of abnormal cells that indicate cervical cancer. Most people have talked about pap smear. They're actually scared of doing the procedure because they assume that it is painful. It might be a little bit discomforting. I'll be showing us how it is being done now so that people can be encouraged to do more of it. As you can see from this picture, okay, this is a picture of the human female anatomy. This is the entrance into the womb. This is the cervix itself, this round dome-shaped structure that has a tiny dot in the center. That's the cervix. This is the womb itself. This is the ovary, these are another ovary, these are the fallopian tubes. So the procedure that is being done, which is the pap smear, is just inserting a very tiny brush through this pathway to take part of the cells and check for the presence of abnormal cells and also the presence of the human papillomavirus, which is the most common cause of cervical cancer. So as you can see, this is what we call a speculum. This is what actually scares most people because it is actually discomforting when it is placed in the private part. I'll be showing us how the doctor, how they do it gently to make it less discomforting, to make sure they do the procedure. So as you can see, this is assumed to be a woman. This is the private part. Okay, this is the thigh, this is the other thigh. But it is more delimited here, as you can see from this structure. So you can see from this structure the tiny hole inside this private part. That is the cervix. That has a tiny dot at the center. God is so great that that tiny hole is actually where babies are being delivered in a pregnant woman. It becomes widening and also becomes thinner to make sure delivery is easier. That is actually where the pap smear is being taken. What pap smear does is it checks for two things: the human papillomavirus, usually the 16 and the 18, which are the high risk human papillomavirus. Because I mentioned that human papillomavirus is the most common cause of cervical cancer. And also check for the presence of abnormal cells around the cervix. Abnormal cells, if present, indicates most likely a cancerous growth. So the way to do the procedure, once the woman presents at the hospital and all the materials needed are being set, the woman will be asked to take a consent for the procedure. A chaperone will also be inside the procedure room, someone that will just be there as an evidence. Then this speculum, which is the most important most important item, will also be present. There will be a gel to make the lubrication easy, and they're also going to be brush and some other things. So when the woman lies down, the woman lies on the back. They raise the two legs on two standing structures, just like this, in order to expose the private part. Once the private part has been exposed, it is going to be cleaned gently with any of the clean agents. Once it has been cleaned, the speculum is going to be gently passed into the private parts in order to get to the cervix. So you see how I'm going to do it now. So this is how the instrument is. It has a mouth like a duck. You can easily open and close. So the goal is to put it into the vagina, which is a private part, and open it while it is already inside and adjust the knob. This is an adjustable knob. So once it is going in, the person that is performing the procedure is going to bend the speculum this way. Nobody will put the speculum this way because it's going to cause a lot of discomfort. But it's going to be passed this way, okay, gently, as it's going gently. That's after we have lubricated the speculum in order to make it easy. Then as it's going gently, once you get to the end of this speculum, the person will now rotate it this way, okay. So once it has been rotated this way, you will now press this and adjust the knob in order to make it visible from inside. You see what I'm talking about now? So from inside now, you can see that the cervix is now visible from inside. Please show them the cervix again. Thank you. Alright, so once the cervix is now visible, a tiny brush will now be taken and used to take from the cells around the area, and this tiny brush can either be dipped in a reagent in a bottle or taken to the lab so that this can be tested under the microscope. Now, once the smear has been taken, once it has been taken by the doctor, there is actually a way to gently remove this speculum so as not to cause you discomfort. So it is very important that you know that doing a pap smear does not cause you the pain that you assume it causes. It just causes you a little bit discomfort. So this is how to remove it now. Once they are done taking the smear, they unloose this knot. This knot I'm using. Once it has been unloosed, then the speculum, the tip of the speculum goes back to its normal shape. Then they rotate it to become vertical. That means it can easily come out, you can see. But if I want to come out when it was like this, coming out like this has been causing a lot of discomfort. So the standard way to do it, and which is what people do to reduce your discomfort, is to remove it this way. And once it has been removed, this speculum is a single-use speculum. It is going to be discarded. However, there are some that are made up of some other materials that are not single-use, can be washed and sterilized and used for another person. Then you are going to be asked to come back for your results in 2 weeks' time. So like I said earlier, the check for two things depends on the human papillomavirus and also for the presence of abnormal cells around the cervix. How do they analyze the results? I'll also be telling you this shortly. To analyze the results from the pap smear, there are two things that we should put in mind: the results of the human papillomavirus and also the nature of the cells around the cervix. Yeah, so checking the results of this pap smear, we take two things into consideration: the human papillomavirus and nature of the cells. If the human papillomavirus is positive, you now go ahead to check for the nature of the cells. If it is positive, you have this. So if the nature of cells is inconclusive, you'll be asked to come back in 3 months' time to repeat the test. Okay? So if the human papillomavirus is positive, you now have mild abnormal cells around the cervix. You'll be asked to come back in 12 months' time to repeat the pap smear. But if it is positive and you have significant amount of abnormal cells around your cervix, you are going to be sent to do a procedure we call colposcopy, which the camera is being used to visualize the cervix. So it's going to show it in real sense of it, what the cervix looks like, and also where the abnormal cells are, so that this can be taken as a form of biopsy while doing that procedure and tested under the microscope. And if it is confirmed that the abnormal cells are actually there and they are found to be malignant, the person will be sent for a treatment as soon as possible, which most of the time will include surgical operation to remove the womb or to remove part of the cervix. Radiotherapy, where radiation will be shined to where the abnormal cells are, or chemotherapy, as the case may be, where medications will be given through the veins in order to kill these abnormal cells. So that's what we do entirely. But if this human papillomavirus is negative, the person will be asked to come back in 5 years' time, which is the routine period of time where they have to be doing this pap smear screening. So this pap smear screening, it is mandated for every woman of reproductive age group to do it every 5 years. So this is very important in order to detect for the presence of cervical cancer and also to help us pick these abnormal cells early, where treatments can be started and also you live your normal life. Thank you for watching this video. Kindly share it if you find it educative, share it with your loved one, and also subscribe to my YouTube channel to watch out for more. Thank you.